Hi, welcome back to Everyday Behavior. This is the second video in our series this month on early childhood referrals. So in this video, we're going to talk about why to ask for a referral, when to ask for a referral, who to ask for a referral, and what to ask to be referred for. So if you suspect that your child has a developmental disability or is not meeting their developmental milestones, why should you ask for a referral? So research indicates that early intervention is more likely to have long-term effects and a positive impact on later skill development. What the research also shows is that early intervention, as young as 18 months of age, or whenever developmental delays are first suspected, has shown to improvements in improving IQ, their learning ability, and their social skills. So of course, this depends on all of the variables that impact the disability or the delays that we're seeing. But what we do know is that while that brain is primed to learn, while it is in that developmental window where normal development is occurring, if we strategically intervene during those phases, we can remediate some of those delays and get kids back on track. But the bigger the gap gets and the more windows that are missed, A, the more time we have to make up, but also B, the harder it is to close that gap. So if we intervene when the gap is really small, it doesn't take a lot to close it. But if we wait until that gap is really big, then it takes even more resources, time, and just general intervention in order to close that gap. Next, when should you seek that referral? You want to seek a referral when you have concerns with more than one developmental skill. So maybe they walked late and you're also noticing delays in play skills, or maybe they were a late walker, or they had some feeding concerns when they were an infant and early toddlerhood, maybe going from purees to solid foods, or were just very particular with their bottle or extra fussy and had trouble self-soothing. If you had more than one concern, that's when you probably want to seek a referral. Or if you have concerns that are repeating. So language concerns. Okay, well, we made it past that milestone, but now we're not making it to the next one. So, okay, we weren't necessarily using our first words, but then we started using our first words, but now we're not really expanding our vocabulary, or now we're not making two-word combinations, or that fluency or articulation is really delayed. Then we have more than one concern. Even though it's in the same skill, it's more than one concern. Another time is you may not notice it. Sometimes when we're in a situation, we don't notice where there might be areas of concern. You kind of have to take a step back, and it's always easy to look outside in. And also, when it's part of our day-to-day, or if it's your first child or your only child, you may not know what typical looks like. And so it may be typical or normal for you, but it may be that in comparison to other children their age, that they are experiencing some delays. And so when more than one person has expressed a concern, maybe a close family member and the pediatrician, or your daycare provider and a close family member, when more than one person has said they have some concerns or mentioned it to you, that's probably a sign that it might be time to seek a referral. Referral lists are often very long. In some states or regions, the wait list can be more than a year long. So if you wait until your next well-child exam to get that referral, if that is then another year waiting on a referral list or longer, you could be delaying that early intervention. And by the time you actually get that evaluation or that service that is needed, it could be that that gap has really gotten pretty big. So you really want to seek that referral as early as possible. It doesn't hurt to get an evaluation. It's not like going to get a shot or having surgery. It's going to look like a nice person is playing with your child. So early assessments often are play-based. And so kids typically have a very good experience when they go for those early evaluations. Yes, it's something different, and they might be kind of scared or anxious or nervous, but it's not something that is going to be painful or hurt or is something that is worth being scared of, other than what the findings might be scary for you as a parent. So therefore, it's better to go ahead and seek that early referral as soon as you have concerns. You don't want to wait until your concerns are significant, because then you're in kind of the crisis, panic, or emergency mode, and it's really hard to get moved up on a waiting list. Next is, who should you talk to? So if you have concerns about your child's development, there are several people that you can talk to. The first person you can talk to is your pediatrician. You're going to want to go in for an office visit and talk to them about your concerns and request that evaluation. You can also talk to the local school district or the local health department. So in every state, there's a program called Child Find. Child Find is a program to find children ages 3 and under who may be at risk for having developmental delays or educational need. And so 3 and under is usually serviced through the health department. And then once a child turns 3, the local school district is responsible for providing early intervention and early education to children who may have developmental delays, including speech delays, occupational delays, learning delays, or suspected autism. And so you can talk to your local school district as well and ask for an initial evaluation for special education services. You can talk to a speech pathologist, an occupational therapist, or a physical therapist who may have experience in this. But in order for insurance to cover that, most of the time for speech, occupational, or physical therapy, you are going to need a referral from your pediatrician in order for your insurance to cover it. Lastly, you can schedule an appointment with a mental health professional. Maybe this is a counselor or a psychologist who specializes in children, pediatric developmental disabilities. So you want to call and find a specialist or a mental health professional that specializes in these. Typically, in order to schedule a psychological evaluation or a counseling appointment with a therapist, you don't need a referral from your pediatrician. That is going to be dependent upon insurance carriers and insurance plans. So some insurance providers do require that initial referral from the pediatrician, but that is a very small subset of providers. So like I said, you'll likely need a referral to access some of those services. However, requesting a referral from your pediatrician or your teacher often allows for those services to be covered by the school or your insurance plan. So what exactly should you seek a referral for? We're going to talk about that a little bit more in depth in the next video, but concerns with any of these general areas should receive a referral. So if you have concerns about language development, using their first words, combinations, fluent speech, or the articulation, the way that they form words, their R's, their S's, their TH's, their SH's. If you have concerns about that speech articulation and not being able to understand what your child is saying, that would be a good time to seek a speech language referral. If you have concerns about their daily living skills and their self-help skills, these are typically occupational therapy referrals, but it's things that require your little fingers, those little bitty muscles. And so these are things like using a fork and a spoon, or the appropriate tripod grip with a pen or a crayon. It could also be feeding concerns. So OT can help with some of those feeding concerns, as speech therapy can also help with a feeding concern. It depends on the type of feeding concern. So if it has to do with the way the mouth moves and the muscles in the mouth, typically that goes through speech therapy. But if it has to do with the texture, the taste, or the sensory experience of feeding, a lot of times the occupational therapist can help with that. You may have concerns with gross motor skills. So this is large muscles. So your arms, your legs, your core. This is going to need a physical therapy referral. So if you have concerns with your child reaching across their body or coordinating things, handing things from one hand to the next, that may receive a physical therapy referral. If you have concerns with their gait or how they're walking or toe walking, that might need a physical therapy referral. If they only turn to one side, they don't look the other direction, that would also need a physical therapy referral. So these are all excellent areas to seek some of those referrals. Other areas would be if you have concerns with social development. So this is responding to their name, laughing and smiling at a parent or caregiver, engaging in cooperative play or imaginative play with a peer. that would be something that you would definitely want to talk to your pediatrician about and possibly seek an early referral for an autism evaluation. Or if they have emotional regulation concerns, they have extreme tantrums and a hard time coming down from those tantrums. Educational concerns could be not meeting benchmarks in any of the following areas. That's early numeracy skills or early literacy skills, your early writing skills, such as, again, that pencil grasp, and those listener skills, being able to sit in their desk, sit at the carpet, line up when asked, follow simple directions in the school setting. Those are all things that you might want to seek a special education referral for. So thank you for watching today. We encourage you to visit our website at www.everydaybehaviors.com. Also to hit the red subscribe button below to receive additional updates when new series are posted. And continually follow us on Facebook to see all of these resources and to access additional information. Thank you and have a wonderful day.